everyone to the, I think, third session or fourth session at the Tufts Energy Conference on the first day. Thank you everyone for being here, as well as everyone who's joining us online. This panel is going to be on the health implications of the energy transition. Essentially, in this panel, we're going to talk about the various health impacts that many sources of energy have on public, worker, community, and environmental health. Whether it's through their production, their usage, or the supply chains, there's somewhere a health impact that's often obscured, whether it's fossil fuels or renewables. And we think that's an important dialogue worth considering as we try to make a transition that's just, that's inclusive, and that's equitable. With me today are our two panelists. We have Dr. Donna Vorhees. She is the president, she's the vice president and CEO of HEI Energy, which is an affiliate of the Health Effects Institute based here in Boston. She leads HEI Energy's work in providing high quality and impartial science about potential human exposures and health effects associated with unconventional oil and gas development. She has served on numerous peer review panels, including reviews for the US EPA, the Consumer Product Safety Commission, and Health Canada, and several advisory committees. She's also an adjunct assistant professor at Boston University's School of Public Health, where she teaches risk assessment methods. Dr. Vorhees received her SCM and SCD in environmental health from the TEC Chan School of Public Health at Harvard. Along with her, we have Dr. Kimberly Humphrey. She's a climate change and human health fellow at Sea Change, which is the Center for Climate Health and the Global Environment at the TEC Chan School of Public Health. Dr. Humphrey is also an emergency physician from Australia. Her main research focus is the adaptation of health systems to climate change, particularly in relation to emergency medicine. She also focuses on the health impacts of energy sources in its usage and supply chains, and is a board member for Doctors for the Environment in Australia. Dr. Humphrey has a master's in public health and tropical medicine from the James Cook University, postgraduate degree in clinical education, and an associate fellowship of the Royal Australasian College of Medical Administrators, and is also a certified health informatician. Thank you both for joining us and taking your time out to join us in person, especially for this incredibly important topic. So for the audience here, we're going to be discussing this panel in 4 broad questions, right? The 4 questions that we have that we're going to explore, and in its themes and issues, are: why do health implications in the energy sector matter? How does energy production and its use affect health, and whose health does it affect? What must we consider moving forward as we frame policies for a just transition? And how can we tailor messaging in a way that integrates these concerns without slowing the transition down? And that's essentially the framework of how we'll proceed with this panel, which is going to be largely conversational and pretty interactive. I'll be asking a few questions here and there because I'm not important on this panel at all, and eventually be opening it up for everyone here and people on Zoom for questions you might have. So starting with the first question, which is: why do health implications in the energy sector matter? And for this, we're beginning with a couple of pictures that Dr. Vorhees shared with us. So I'll hand over the floor to her to talk us through them.
Great. So hi, everybody. Really glad to be here with you today. So I think the most important thing is that we learn from the past. So the first image is an image from the past, and it's not the past for everybody. There are places that look like this globally, but at least for this particular location, it's the past. It happens to be my hometown in West Virginia, the steel mill. My middle school is right on the other side of all those belching smokestacks. And this is the 1970s, around the time that the EPA was formed, shortly after the EPA was formed, and we got all of our air pollution regulations underway. But before that, there were professors, actually people who turned out to be my professors at Harvard, came here in the 1970s and made the link between the emissions from these smokestacks and the effects on people's lungs, right? But of course that happened decades after this industrial operation happened. So the usual pattern that we see in the past is we implement a technology, we wait for the health effects, and then we find out later that health was harmed. So this is the past. And then if you put on the next slide, so I'm calling this the present, at least in the US and in a number of places around the world. You've heard of fracking? You've heard of fracking? Okay, so this is a well pad. There are 3, should I use the clicker? Or is there a pointer?
Yeah, this button right here.
Okay.
The second button right over the red line.
The red, okay. There's 3 wells right here. And what you're looking at is a hydraulic fracturing setup, a massive number of trucks, usually diesel powered trucks, although that's changing in a lot of places. But as you can imagine, this is nice daylight here, but imagine all of those trucks roaring. Imagine the light and the noise. Imagine the chemicals being used in hydraulic fracturing fluid and emissions from them. People living near this got really upset, right? So oil prices hit over $100 around the turn of the century. People went crazy. We're going to go out and develop this oil, develop this gas. And that all just happened really, really fast before we knew the implications for people living near these operations. So here we are, it happened again, right? So all of this development happens, but there was nobody stopping and saying, wait a minute, what will this mean for the communities around them and how can we protect them? Fortunately, there have been a lot of changes since they started, and there are quite a few home protected measures in place, but it was slow. And this one, and I apologize for the blurriness of it, but it's the best image I could get. And I just wanted to talk about one possible future, and this isn't, I'm not advocating this is a future at all. It's just the one place in a plan for Western Pennsylvania in this country where they're looking at a mix of energy sources. What does the future look like so they can reduce carbon emissions and other types of emissions and also keep their economy going in the process? So they are recognizing the interconnectedness of and the need to upgrade grids. They want to use natural gas and nuclear power. This region has loads of natural gas, also has nuclear power plants. CCUS, carbon capture, use, and storage. So yes, we have natural gas, but we're going to capture that carbon from that process and also from industrial sources. They want to be a hydrogen hub. Have you heard about there's a huge initiative now, DOE funding for hydrogen hubs in the US. They want to be one using, sorry?
Hydrogen hub. Do you want to just elaborate?
Hydrogen hub? Yeah, absolutely. So right now, the Department of Energy in the US is accepted proposals for being hydrogen hubs. So the idea is at several places, and I think they want to fund up to 4 of them. In the US, they want to develop hydrogen as an energy source and make these locations hubs of energy, of hydrogen development. And so what that means is the industrial processes you need to produce hydrogen and all of the infrastructure and other things that would be associated with the hub. I think they want one of I believe one of them is supposed to be sourced from natural gas. So methane as the source of the hydrogen. And then nuclear can also be a source of the energy, right? To split water, and then solar and wind. So, and sometimes people associate colors with these. So nuclear is pink, solar and wind is green, methane is blue, or natural gas is blue, right? But this region is very rich in natural gas. So they are wanting to be the region that gets the blue hydrogen hub funding. Thank you for the question. Yeah. And then renewable power. So they've got their little renewable power here, the nuclear power here. You've still got the natural gas development happening. We're capturing the carbon, got all the processes associated with that. And the reason I wanted to show this graphic is just if you live near this, there's a lot going on, right? And so right now, the conversation in this region is about reducing carbon emissions, great. And it's about growing the economy, great. Not a lot of discussion about what does it mean to live near all of this? There will be emissions, there will be traffic, there will be construction of infrastructure, there could be leaks. So it's important that, that we look at these conceptions of the possible future and think about those implications so that we prevent problems.
So on that front, like, we had a conversation about this when we were putting the panel together, which is it's a lot of the information and the research in the space is a bit scattered, right? And even when I was speaking with other experts in the energy sector, including professors, asking about the health intersection and whom to speak with, a lot of the times the responses I got were, this is really interesting, I'm not quite sure. So I was curious to know both your opinions on the current state of research and advocacy in this space, and particularly what are the kinds of challenges you face in trying to mainstream this kind of health consideration within the energy transition policy kind of discourse?
Absolutely, I can probably go first, give you a little bit of a break. Look, so I think that there's a few things. Number one is the health implications of the energy transition or energy impacts are not necessarily particularly appreciated within the health sector itself, unless you are somebody who has specialized in this particular area. So speaking as a clinical doctor, I think most people that I practice with or went to medical school with would be very binary about it. So they would say fossil fuels bad, renewables good, just looking at the broader picture. Because when we think about the impacts of energy, we need to think very broadly in terms of climate change and what that's doing to our planet. But then, as Donna has said, we need to think very locally as well. What are the health impacts when people are living next to a fossil fuel project, for example? And aside from those obvious ones, air pollution, we know what that does to respiratory function. Not everybody who's involved in this space really thinks about everything else. What are the impacts, for example, of cobalt mining on people who live near that? And so that is a challenge, I think, within the sector. And then if we're moving outside health, one of the challenges is that I think people don't always equate health with anything else that's going on. So if you're talking about transport, for example, I was recently at the UN Climate Change Conference in Egypt, and I spoke to some of the people there from the transport sector and said they were running a panel that didn't have health on it. So I said to them, why not include health in this panel? They said, what does that have to do with transport? That doesn't need to be part of this conversation, which to me was quite frustrating. But it just really highlights that we need to have those people in the room, because the discussion about transport shouldn't just be about electrification. It should be, what are the alternatives? How do we build a greener society? What about the co-benefits of active transport? There's all of these other things there that need to come into those discussions. So it's representation as well. And the other big one that I've encountered when I've done policy work in my previous roles, I've worked for the South Australian government in public health and climate change policy. And a big one we come up against is cost. So when we're talking about this, I go, it's very expensive. Why should we do that? So the argument that we've made in that instance is, you look at the long-term healthcare costs due to climate change, they're enormously significant. And then now there's very good evidence to say, well, actually moving to renewables is not more expensive. So we know that $7 trillion a year is spent on fossil fuel subsidies. If we spent $4 trillion a year, we could fully move to renewables. So that economic argument now is also something that we're able to use a little bit, but that's what has been a challenge.
Great answer. Actually, first I'm going to put in, maybe think of something. So a plug for some work that my organization did. We're a nonprofit scientific research organization, and my colleague just finished a massive review of the traffic literature and the health effects associated with traffic, and it's like 800 pages long. So you can send that to your friends who thought that there was no issue. So I guess just adding to that, so I'm in the environmental health field, I'm not a physician, but I think that, it's been a long time getting the world and this country to face and confront the reality of climate change, and the momentum is building towards doing something about that, and the momentum is building toward renewables. And so I think talking about the health implications of the renewables is, I'll say, uncomfortable, right? Because it's been so hard to get to this point. You don't want to say anything to set it back. But at the same time, being a public health scientist, we've got to think about this more holistically, or we are going to have problems down the line. And so the challenge is, how do you do that without setting back progress? But I think that's the challenge that I've seen primarily as well.
And it's interesting, the anecdotes that you mentioned, because like a lot of the times when people think even about the health impacts, like first and foremost, it's associated with fossil fuels. But a lot of it, like the domain in which we measure this kind of impact is typically associated with where it's being used, right? Where are we burning this fuel and where it's being used, and who's going to be around it to face the implications of that energy being used. Not as much thought goes into where it's being produced, where it's being processed, how it's being transported, and what are the sources that are being excavated from different places and how that's happening. So there's a whole supply chain to this issue that has various facets of health impacts. And that's kind of effectively what our second question is about, right? How does energy production and use affect health, and whose health does it affect? Because we're not just talking about burning petrol and the people around it who are exposed to its to the smoke. So Kimberly, I was hoping that you might be able to speak to this, particularly with the slide that you shared with us on this map.
Absolutely. So what I really want to highlight with this as we go further into this discussion is that, so we'll start off with climate change more broadly. So climate change disproportionately affects those who are already marginalised. We know that on a global scale, and that's what this is showing. And in a moment, I'll go on and talk about how that's true on a local scale as well. So we know that people who already live in poverty, those who are in communities of colour, those with significant medical conditions, they all suffer more greatly from the impacts of climate change. When we're talking about energy, and if we're talking about fossil fuels to begin with, we also know that fossil fuel projects and risky fossil fuel projects tend to be concentrated in marginalised communities. They're generally communities that can't say no, for example. They aren't wealthy enough to move away if something like that comes with them. I'm sure that many of you have heard about Not in My Backyard, and that's along the same thing. So people who live in wealthy neighbourhoods have access to their local representatives, can mobilise, can prevent those things from happening near them. People who are from poorer neighbourhoods often cannot do that, and then they end up living next to the oil refinery, the fossil fuel plant, next to a fracking tower, and all of the health implications therefore impact those communities much more than they will impact wealthy communities as well. So it's true for climate change and for fossil fuel production as well. Next slide, please. This is just to highlight the social determinants of health. I'm sure many of you will be familiar with this. So when we talk about health, it's not just heart, lungs, brain, it's all of the other things that make a person healthy. So where they live, their educational status, how much green space they have around them, their access to food, all of those things make people more vulnerable to climate change. And also they are the communities that suffer more from being near fossil fuels and all of the associated health effects. So there's a very significant equity issue here. And we need to be very mindful of that when we're thinking about transition too, is an argument that I've heard many, many times is, yes, health is important, but this community needs to put bread on the table. They're a cold community, they need to be able to feed their family. So you have to think about the health implications, for example, of somebody then not having a job, and balance that out. Now, there are good solutions to that, but we need to have sensible conversations about this and really think about the transition when we're going through everything. Next slide. Okay, I don't agree with this perspective, but we absolutely need to highlight it. So this is a clip from Twitter. This is really to highlight that the energy transition is dual purpose. So there is significant energy poverty in the world still. There are 780 million people who do not have access to electricity, and many of them are in Africa, and we cannot ignore that. So there is a big argument and a big equity argument that comes from many communities to say we still don't have electricity. Many of these places are quite oil rich. We deserve to be able to use that natural resource to be able to power our homes in a way we haven't done before. However, what we also know to counter this is that renewable energies such as solar are cheaper. They don't have the health impacts on local communities, because once again, these fossil fuel sites will be located in more impoverished communities, will have all of those health impacts on those people who are already suffering. So locally, is going to have significant health impacts if we say, sure, you deserve to use oil, for example. And globally, it's going to contribute to us not being able to keep our global warming under 1.5 and all of the huge health impacts that will have, which will also include greater health impacts on these communities as well. So one of the big arguments that comes into this is the need for finance to support these communities to be able to invest in renewables and to move away, and the health benefits that will have as well. So I think that's just a really important point about equity that we need to think about going forward. Next slide. And that's basically what I've just alluded to. So on the left is use of solar power to power electricity in a home in Africa. And we mentioned before cobalt mining as well. So mining of renewables has health impacts on the communities it's located in terms of the effects of modern slavery and the effects of mining itself too. So we need to be thinking very carefully about how we need to do this in a sustainable way that doesn't harm those communities either. And I've mentioned finance.
Sorry, could I just ask the last slide? It wasn't clear to me what the point of this, the Twitter person, what point is she making there?
Yeah, so the point, and I spent a little bit of time deep diving through this account. So basically, the point that they're making is that these people deserve to be able to use the natural resource. The rest of the world has been plundering this resource, and it's their fault that, for example, climate change has happened, and they're saying, no, we should be able to use this, and it isn't going to make a big difference in the long term. You've had it, now we deserve it. So I don't think it's a particularly strong argument, and a lot of it ignores a lot of the arguments for climate change in general.
Those graphics, I'm not sure. So Las Vegas, Nevada uses the same amount of energy as Kenya, the whole country of Kenya. Is that the point there?
So this is what they're saying, is
Yeah.
basically the Western world is taking all of our electricity
I see.
and we deserve to have it.
Got it.
Yeah.
Okay. Thank you.
Yeah, so on that point, I was curious to know in the course of your research, both of yours, looking at conventional and unorganized oil and gas exploration, as well as looking at cobalt mining, as well as like the impacts of fossil fuels. I was wondering if both of you could speak to the kinds of health impacts that you typically see in these kind of scenarios, and the kind of indirect or second order consequences that those have for communities and for societies. I was wondering, Kimberly, if you could start by shedding some light on it from your clinical, like medical perspective, like
Yeah,
just without spooking people too much.
No, exactly. Absolutely. So I'm going to stick to the health impacts. I'm sure some of you have had a lot of the arguments around wind and birds and all of those arguments. But in regards to the health impacts specifically, we know, and it's established in the literature, I've seen it in my patients, that people who live in communities that are near fossil fuel plants have worse health outcomes. So that's in terms of lung disease, higher rates of heart attacks, stroke, cancer. I have practiced in Australia, where I usually practice when I'm back there is quite a higher socioeconomic community, but I have practiced in places that are coal communities, for example. And what we see there is we see people who have higher rates of those diseases I mentioned. You just see it every day, people coming in who have more respiratory problems, who have more of those sort of chronic problems, especially when they're young. But also the other thing that you notice is that these are communities that already are marginalised and have those issues as well. So you just see that the health of that community around that site is really disproportionately affected to a community that you might see in an emergency department in a more urban city. Now, health effects of, I guess, other forms of energy, I have not practiced near nuclear power plants or anything like that. And certainly where I'm from in Australia, we have a grid that's powered 67% as a rule by renewables, occasionally up to 100%, which is solar and wind. And I have not seen patients that are affected in any way significantly from a health perspective from that. So.
That's a huge question. So as I think Kimberly explained, there's a very large and growing literature on some of the criticisms of the literature have been that a lot of the studies are associating distance with adverse health outcomes. And so is distance the right, are you really sure it was the oil and gas, or could it have been something else in that vicinity? So that's one of the criticism. That's actually why what we're doing in our organization is funding research on what people are exposed to, these operations. And it is to understand what are people exposed to, and linking what they're exposed to back to the very specific operations that lead to that exposure, so we can start to understand where are their problems, what can we do about those problems. If you talk to people in industry, they'll say, hey, we plan all of this, we take great care to ensure people's health. The reality is the industry, it isn't the industry, there's tons of operators and they operate differently, and some of them operate very responsibly and some of them, I don't know, they have violations, right? So there's a huge disparity in what's happening out there. But we're trying to understand what that is, because everybody can want renewables to start tomorrow and we move to that entirely, but if we want to keep these lights on, that's not going to happen. So we're trying to understand what are the exposures that are happening now, and what are the exposures that are going to be happening in the next 5 years, the next 10 years, and see what we might do about this. I've been asked many times, why aren't we doing a health study, a human epidemiology study? And personally, I've resisted it because I lack enthusiasm to go to a community and say, we want to study you and see what happens to you over time. I'd rather understand the processes, understand what's ending up in the air, what's ending up in water. Is that a problem for health? If that's a problem for health, we do something about it.
So when we look at like emerging fuels, and I remember we spoke about it briefly before this panel, particularly when we look at things such as geothermal, when we look at nuclear, particularly on the side of, say, waste disposal or worker health. I was curious to know what, and I know HEI Energy has looked at a bit of that as well, and we discussed it too. So I was curious if you could talk a bit about that as these emerging sources that have a lot of enthusiasm behind them, but perhaps need a few more considerations to account for as we try and develop projects.
Right. I mean, so we haven't done anything yet because there's not a lot of geothermal happening, right?
Of course, yeah.
It's talk about the future. Same with hydrogen.
Yeah.
And nuclear. Well, they're nuclear power plants, but the SMRs, the small modular reactors, that's a newer phenomenon. And but so geothermal is really interesting. Geothermal is very interesting. I mean, the idea that you extract energy and heat from the earth and you use that in your homes. It sounds wonderful to me. A great way to heat our homes and heat our buildings and not have emissions. To get that energy out of the ground is, there's a technical process involved and could be used. That's the hydraulic fracturing that I showed you. Hydraulic fracturing could be required for some of it. I don't know ultimately how this will all happen, but my mind goes toward, for better or for worse, my mind goes toward what could go wrong that could affect somebody's health. While somebody else is saying there's great potential here, let's go for it. It could be great for the climate. So I think we need both heads in the room. I think we need the optimist saying, let's go for it. This could hold great promise, geothermal. And then you need somebody like Kimberly or me in the room saying, let's just, okay, but while you consider that, let's think about what could go wrong and let's prevent it rather than wait for the inevitable, either the inevitable health effect or just somebody be worried about health effects. I mean, I think some people live near operations and I have a long history of working around hazardous waste sites. Some of them I know through our measurements, they weren't exposed, but they're sure they were, and they feel effects. So we want to prevent that too, because stress can hurt your health, right? So, I think we need public health scientists thinking about these innovations along with the engineers, along with the land use planners, and along with the economists. Hydrogen, same thing. I showed you the image. It was a fuzzy image, but the same thing. It's not going to be one little factory and it's over here and it's separate from everybody. It's going to be an operation, and there will be people living nearby. And Kimberly said it very well. People will be exposed, and also not only do you need to think about that, but who is exposed, and are these risks distributed fairly or heterogeneously or homogeneously across the population? I think we also need to think about the health benefits too. So those of us in the environmental health field, I called us the skunks at the party earlier. We're the ones saying, well, you can do that, but yes, engineer, you did this amazing innovation and it's a miracle that you could do that, but I'm going to go rain on your parade and tell you all the ways that, people's health can be harmed. And so, we need to think about that. But I also think, particularly amid this transition, there's the potential for great health benefits. And let's try to quantify those, and let's try to use that to help guide this development toward the best possible outcome. I should say outcomes, right? Because it's going to be different for different locations. And nuclear, I believe you told everybody that the speakers were anti-nuclear. Is that what you said?
Just my fellow organizers, because just to make sure that they attend. But speaking of which, when we were talking and we were actually discussing this, you brought an interesting anecdote, and you were like, you have a kind of grandmother's advice or approach towards looking at this as one of those things that needs to be explored, with the right people and with moderation. And I was wondering if you could speak to that, particularly what you mentioned earlier. Yeah.
Well, as we were planning the session, I just said grandma's advice, everything in moderation has its place, energy policy. But I said it because I think my colleagues in the public health field, a lot of them, you mentioned the binary attitude. I think they think, okay, every region, everywhere in the world, solar and wind, you got it covered. That's all you need. And there are regions where just solar and wind can do the trick. But where I come from, heavily forested areas, the house I live in now, we tried to get solar panels, and they told us how many trees we'd have to cut down to have solar panels. So the right solution is going to vary by region, and I think we need to keep open minds. If our focus is not politics, if our focus is protecting people's health, what is the mix of energy that's going to help us benefit health as much as possible. While, by the way, growing economies, everybody wants jobs. I'm all for that. And the other thing I was told as a child is that first image I showed you, my mom said when she was growing up that they called the soot black gold. It's black gold because of one of the things you said. We have to tolerate this because that's what we tolerate to have these jobs. So since I've been a little girl, and the reason I'm in environmental health is because I reject that notion. I reject that notion. I think if we truly monetize the health effects of the things we're doing, we can have jobs and we can have good health. And that's what motivates me, and that's why I'm here.
So I guess that sets us up for what was the third question, right? Which is the big piece here, which is starting with the idea that there's many reasons why we should be thinking about this, but there are various circumstances in which we don't think about this. So from the perspective of like policy design, from whether it's looking at it on a macro level or particularly, like you said, tailoring it to specific regions, what do you think are things that we must consider as important pieces in framing a policy design that allows for inclusivity and justice in this transition? And I know, Kimberly, you had a few slides that you wanted to share with us on this.
Perfect. Thank you very much. So I guess the first thing to say would be, and often when I've had these conversations with people, they're like, oh, it's just the health stuff, it's fluffy, and it's the money is the important thing, etc. And I think we've really established now that there is significant economic savings in moving away from fossil fuels. And more than that, if we don't have a livable planet. It's that simple at this point. So I think we have appreciated what we need to do, but how do we get there in a way that is just, as we've discussed, making sure that we don't repeat the mistakes of the past and that we are appreciating that the impacts aren't equitable, even when we're talking about transition as well. So what we really need to talk about isn't just energy, it's also communities and society as well. And it's not a binary thing in terms of just replacing old energy with new either. There are a lot of things about our society that don't work, that aren't equitable. There are still people who live in poverty. We know that there are different outcomes for different ethnic groups in terms of education and job attainment and all kinds of things that we need to really tackle to have a more just society. And the exciting thing about all of this, I like to look for a silver lining, is this is a really good opportunity to do that and to create a better society for everybody, whilst, as Donna said, maintaining jobs and thinking about all of those hard economic impacts as well. So that might be things like, do we need to keep running our society in the way that we are? I think we need to have these conversations about consumption and exactly how we live. Electrification versus active transport. We know that even people who catch public transport have more active transport. They walk to get there. And so they have the health benefits from doing that as well, even if they are not walking the entire way. So there's a lot of health benefits from not driving your electric car and catching the bus or walking to where you need to go as well. And so we need to be having discussions about how we remake our cities to be more friendly to encourage that kind of activity. Next slide, please. Yeah, and this is really just illustrating that. So we've got, these are the pathways we can go basically. So we can kind of head where we're heading, and then we're heading all the way down.
Use a pointer.
Oh, thank you. I'd love to use a pointer. There we go. So this is kind of where we've come from. So these are all of the dimensions that enable us to get where we might need to go, good and bad. And if we head down here, we have increasing warming because we don't do anything about fossil fuels, but also we're failing to meet some of our sustainable development goals, which some of you might be aware of. It's things like eradicating poverty and making sure that there's energy equity and really ending up in a society that is inhabitable and inequitable and is basically just a disaster. Where if we look at limiting our warming, but we also think about the other things. So how can we increase equity and just outcomes for our communities? Then we end up more up here with low poverty, with better well-being, with more equity and justice and happier communities. All of this is a very good thing. So we shouldn't just be thinking about this in terms of energy. We need to be thinking about it as part of the whole system. I think that's my last slide.
And the same question to you, Donna, in terms of like, and this tracks back to the question on trying to mainstream this and the challenges associated with it, right? Like, so what do you think are important considerations that we need to have? And more importantly, like you said, you look at processes and approaches. So what are some of the things that you think are important considerations we need to keep in mind as we're framing these kind of policies, and who needs to be in the room?
needs to be in the room. So I think who's already in the room are the people innovating, the tremendous innovations we're seeing as this transition continues. And there's tons. I'm trying to keep up with it, and there's so many. Then we also need, in the room also is usually economists, often economists talking about feasibility of these technologies. People like Kimberly and I are often not in the room. But maybe they are. I'm not in every room, right? but I am not familiar with us being in the room very often. Maybe need a sociologist. Maybe it's human nature that we get excited about a technology, we get excited about an opportunity, and we march ahead, and it's not really very much fun to think about the unintended consequences. So we don't think about them. But I think we need health scientists in the room. I would like to be invited into those rooms, and I would take as my challenge or Kimberly's challenge being in that room and not gumming up the works, not stopping progress, but contributing to that in a way that in the long run, it actually goes more efficiently, right? Because you thought about it and you anticipated problems and prevented them. I prevent it to the extent we can, right? So I think either we get invited into the room or we invite ourselves into the room. And I mentioned to Raunaq before, I invited myself into one room in one regional planning effort, and they welcomed me. We'll see how long I stay welcome. But I mean, right now I'm welcome, and I'm excited about it because it's hard to talk about energy transition across the entire planet. So I'm now going to try to help one region anticipate and think about how to maximize health benefits, minimize unintended health consequences, and all of that. Be thinking about who are we talking about in the community? Where's this economic end of the spectrum? Usually the one, right? So let's look at that. Let's not. Because we know the default is inequity. That's what happens all the time. So let's plan for equity to the extent we possibly can.
And I was hoping if you could tell us a bit more about that experience, about working with this community, in what region it is, and how has it been being in the room and being able to communicate with other stakeholders?
It's barely begun, so I
Okay.
I can't say, but it's near actually where I grew up.
Okay.
So it's
In West Virginia?
yeah, in Pennsylvania, but
Pennsylvania.
very near. Yeah, so I can come back next year and tell you.
Yeah.
But it really just got started.
Thank you. And that kind of sets it up for the important question, right? And one of the biggest things that we were talking about, one of the and the little experiment, for the lack of a better word, that I ran with the team as well, which is people get spooked quite easily, right? And you've emphasized how that you don't want to be the people in the room that are stopping progress, and as well as the benefits that come from a transition that accounts for health as well, which kind of pretty much leads us to our last segment in this panel, which is how can messaging be tailored in a way that integrates these concerns without slowing the transition down, but in fact enhancing it. And I know, Kimberly, you had a slide that you shared with us on thinking or rethinking about co-benefits, for instance, as a positive kind of way in kind of envisioning these considerations within policy design. And I was wondering if you could share about that with us. And if you need the clicker again, the laser point.
Thank you. So I think, as Donna said, it's really important. So health, I think there's a bit of a reputation that if there's a health person in the room, we're going to be like, oh, no, this is terrible. Everything must stop. We're putting up a barrier for progress. So I don't think it's true at all. It's providing a little bit of nuance and making sure that we make the right decisions, and also framing it in a positive way. So there are many things that are really positive about what we're trying to do in terms of an energy transition. So I love this. This is one of my absolute favorite slides of all time, and I use it incessantly because it's just very positive. So we're looking at the things we can do. So this is around energy and renewable energy, improving insulation. We've talked a lot about active transport, but all of the benefits that this has, so better mental health, fewer people dying, less heart disease, less lung disease, less cancer, less obesity. And it's just so many good positive benefits from making that move as well. And I think this is quite compelling when you show this to people and say it's not about taking things away from people. It's actually about making life more livable, and that should be for everybody. So making equity the center of this as well is very, very vital.
I don't know. There's nothing to say. I think the key part of that is being positive. I've spent decades in the environmental health field, and we really are the ones who come in and we're a drag. We really tell you what you're doing wrong. We tell you what you're worried about. And I just, after decades of doing this, I don't think people respond to that very well. I think they respond to positivity, and Kimberly's right. There's a lot of positive things happening there. I know right now, like the oil and gas industry, they're, can go away, whatever. Even the oil and gas industry is changing and improving. The public pressures made a difference. They're reducing emissions. Some of them are transitioning to other types of energy. So there's a lot of positive things changing in the world. I think any energy producer doesn't wake up in the morning and say, how can I harm health? They wake up and say, I have this great idea. I'm going to it. So I think it's just a matter of filling that gap, making sure that that's part of the conversation. There are all kinds of analyses that you can do. You asked me about life cycle analysis, which can scare people, but it's smart. It's smart. If you have to constrain it, or you get overwhelmed by it. But really think about, if you start this operation, what are all the effects that could spread out from that? Another way to look at it is we call it cumulative impact assessment or cumulative risk assessment. You think about it from the perspective of the person, and that blurry image I showed you at the first. What if you live near all of that? What does it mean for your health? So there are some tools we can use to help think about this. And if we do it well, we don't paralyze everybody, right? Right. We identify some of the key issues that engineer or that economist wasn't thinking of.
Right. And I guess my last question for you guys before we open the floor was, when we were trying to think of this, and we recognized as we were strategizing about this, that it was a lawyer talking to public health professionals and scientists, and the bulk of the audience would be people who are from the Fletcher School, from the Tufts Engineering Department, a lot of whom are involved with the energy sector, a lot of whom who are going to be stepping into important roles in the energy sector, whether it's the private sector or with government. And I guess one of the things we talked about was we want to kind of make this a conduit for future professionals in the energy space to kind of think about this as we move forward. So I guess just before we open the floor, if there's any parting bit of advice you'd have for emerging energy professionals coming from law and engineering and policy and international relations, what would you like to tell them as a takeaway from this session that they ought to consider moving forward? Can start with Kimberly, I guess.
Oh, it's a very big question. Look, I think there's multiple things. Obviously, to me, I care about people intrinsically, which is why I've gone into the field that I'm in. And just to always remember that all of this comes down to people and their well-being as well. So always just remembering that those decisions impact real people, and that they will impact people who are already suffering more than others, and that all decisions have a consequence. And I guess the other part of it is that, making this transition, it makes good economic sense. There's very good arguments for it, even if you take people completely out of it as well. And those would probably be the main things that I would say. Yeah.
Absolutely. I don't think I could top that, but I guess I would say be confident and innovate in what you're doing. Go for it. Maintain enough humility to realize that there are things you don't know, and be willing to listen to other people with other areas of expertise along the way and benefit from that. I think it's the most important thing. It's just really complicated, right? Even this one region that I've kind of picked to maybe help a little bit, even that is incredibly complicated, all the permutations of what we come. So be humble and listen to people from other disciplines. I think.
Right. Well, I'd like to thank both of our panelists. And I just want to point out that they gave a lot of time and flexibility to try and make this happen. This presentation was put together this morning, along after a few calls over the course of the week, while everyone was traveling, while I was sick. But everyone was like very, passionate about this and clear in their effort that, about the kind of impact that we want to have at this conference by opening up this dialogue and having people consider it as they move forward in their studies as well as their professional lives. So once again, thank you so much for taking the time to join us. And with that, we can open up for audience questions. So, I mean, you can just raise your hand. I request you to please, when I call on you, please state your name and your affiliation, and then please ask your question, and whether if it's for both panelists or directed to one. Virendra, we can start with you.
Good afternoon. I think this was one of the most important sessions which we had. I am a student of LLM, that's Masters of Law. So I will think more from societal point of view. So I'll make three simple propositions and then I'll come to my question. One, throughout our school, we have said health is wealth. When it came to economics, we said wealth is merely a measure of welfare, and welfare means again health, which we are talking today. I've spent 20 years in villages in India, and let me say that not that they don't have electricity, they all have DG sets, so they are all burning oil, even if they are not connected to the grid. It comes at a huge cost of at least 6 to 7 times the cost of generation of electricity. Third, I'm a renewable professional. Today, the payback period in renewable energy, solar particularly, is between 2 to 3 years. I don't think any industry can be more profitable than this. With these three propositions, I don't see why people are not really investing into this sector. It gets you help, saves money, good profitability. Still, it's not happening. So from where you are seated, you would probably be able to see why it's still not happening. Everything is in place, but it's not happening.
Well, okay, I'm a health scientist, so I don't think I can really answer. I mean, I think that's a broader societal question. I think a lot of people are vested in the way things are now, right? Change is hard. Yeah, change is hard. And even though it's possible to make that change and people still have jobs, it's not trivial. So again, my hometown, that steel mill went away, people lost their jobs, they didn't recover. That can happen. So how do you make this transition so that it doesn't happen? I think it scares people. So
I definitely agree. I think it scares people. And, we talk about, there'll be 14 times as many jobs in renewals, but they're not just replaceable. You can't just take somebody who's worked in a coal plant and just put them in manufacturing renewables, for example. It doesn't work like that. So I think a big part of this is communication, and then it is investment in retraining, and it is investment in making sure that there's adequate social welfare, etc., and all of those other things around that support communities do. Because people are scared. They don't understand. They just think, oh, my job will go away if this solar plant comes near us. So I think there's a few things we need to do to be able to encourage that kind of investment.
Yeah, hi. So my name is Nathan Scott. I'm with an organization called Mass Energize. So building on the question that was just asked, I have kind of two related questions. And that is, first of all, it's incredible to me how undervalued health is. I mean, I don't understand how, and so the study recently of the health effects on children from gas stoves caused this huge uproar. Senator Joe Manchin gets up in the Senate and basically says, you're going to take away my gas stove over my dead body. I'm like, I'm incredible at how undervalued health is. And so I'm trying to figure out, how do we value health more? Just in terms of policy and decision making. I'm not an economist, but I'm also thinking about how has there been, or how does one in the health field, how does one actually attach dollars and cents to the health costs of the cancer treatment, of the lung disease? And why aren't we seeing those kind of numbers? Are we seeing those numbers? Could we see more of those numbers? Why aren't we seeing those numbers? Because it seems to me that we could apply some kind of metric to say, okay, a wind plant is gonna, wind plant has costs. And it has costs, and it has, but we've external, and so let's apply that to fossil fuel, let's apply it to renewable, and let's apply some healthcare costs to that, because we know the healthcare costs are astronomical to, the kind of cancer treatments that come about from these fossil fuel industries. So I'm just wondering, whether you are familiar with or what we could be doing to look at this from a kind of a dollars and cents point of view of the healthcare costs associated with this. And just wondering what your comments are about that.
Yeah, so I think it's, you've identified many of the challenges that we have. So I can speak a little from my personal experience where we've really tried to make arguments. And the state that I'm from, South Australia, and Australia is very progressive, as I've mentioned, in terms of renewables and wanting to be, you know, a clean energy powerhouse, and is really quite good in that way. But when we've asked them to invest in health and to invest in having money to look at adaptation and mitigation for the health of our communities, it's come down once again to money. And the answer that we get is there is pretty good literature now that shows what it will cost, you know, X cost to the health system, 680 billion to the US healthcare system from fossil fuel impacts. However, a lot of that is projected, and people have a difficulty often saying, oh, well, that's in the future, and this is what it costs us now to do this. So overcoming that sometimes can be quite difficult, depending on who you're speaking with. And then you encounter people who are like, that's kind of speculative, it's off in the future, maybe it won't be that bad. What we know is it's going to be worse. So we think the last estimates we had were that climate change is probably causing about 250,000 excess deaths a year between 2030 and 2050. That's going to be incredibly conservative. It's going to be far worse than that. But making people see something that's in the future is very difficult when we're talking about dollars and cents now. So I think that is a significant challenge that we still need to overcome. In terms of cost benefit, we're doing a bit of work on that at the moment, actually, through Harvard, looking at cost benefit of adaptation and mitigation measures in regards to health, so we can be able to say more concretely, this is actually what it's going to cost you versus what it's going to save, and I expect to see benefit through that work as well.
Could I just add something? And so planners, I mean, as planners, planners have to be thinking into the future, and they have to be looking at costs. And, you know, not to mention, you've talked about the physical health effects of climate change. What about the mental health effects? And what about all the increased mental health problems that are going to be, that we're already seeing? And the planners are throwing up their hands and say, we don't know what to do, which is an abdication of responsibility, in my opinion.
Yeah, definitely. And it's going to be catastrophic for our healthcare system and for our communities. Just one more concrete example, sorry, Donna, go over to you, is where I'm from in Australia, we have a significant problem with overcrowding in our emergency departments, and hospitals are at capacity. We could have a whole another discussion about that. And when we have gone to our senior health bureaucrats about this, they say, but right now, this is what's happening. Right now, this is the problem we need to tackle. This needs our money. That's in the future. And yes, maybe it will have mental health impacts and all of these things, but right now, this is where our dollars need to go. So they see it as this at the expense of that, and we need to do that right now. And in health, there's always something that we need to be doing right now. And for most health systems across the world, they're in relative states of crisis at the moment. And so when we make that argument, it comes down to dealing with the immediacy.
So I guess I'm not 100% sure what you said health. Do we ever quantify, you know, the health risks and the detriments to health? I mean, we do, for example, you know, EPA designates a place of non-attainment for ozone or something. And so then action has to be taken to deal with that, right? And the basis of that is health analysis, and often a cost benefit type of analysis, but it's certainly a health analysis. We have ambient air quality criteria that are based on assessments of effects on health. So there are assessments, they do happen in this country, in other countries. Action does get taken if these levels get violated. So I guess we have methods, and it does happen, but it doesn't happen in every context, in every situation. It's this function of the rules that we have at our disposal.
Question.
Yeah. Hi, my name's Izzy Antilla. I'm a first year chemical engineering student here at Tufts. I was also on the communications team for the energy conference. So I had like kind of 2 points. I was just wondering like what you guys really, like what the level of like effectiveness, like our government institutions like the EPA or even like local governments, like what steps they take to kind of like aid in this like issue of health from these like energy changes. And then also as somebody who like hopes to become an engineer in the energy sector, like what do you think is like kind of like the best advice for future engineers to keep in mind when like thinking of health?
So I think the first part was what is EPA doing and what are local
Yeah.
governments? I mean, I think EPA is doing a lot.
Yeah.
I think EPA is doing a lot. They get hammered all the time. I think, you know, they're the one agency that gets hammered because they regulate, right? So that can cause controversy. But I think we have an agency that functions as well as it can, and with the funding it has, and with all the controversy that ensues, and the science that it has upon which to base decisions. But I think they're working as hard as they can there and doing it. On the state level, a lot of states are working very hard to develop science-based standards and guidelines for all kinds of development. At the local level, you don't usually see so much. I think could be an exception. Probably California is an exception because it's practically country, so its local governments are pretty huge. But there's a lot going on. Advice. What was the advice for?
Yeah, like an advice for like kind of like future engineers to keep in mind, how to like keep in mind like public health when like making these like energy solutions.
I mean, I'm not sure everything to add. I have more to add to what I said before, but I think recognizing that it's good to think about that, good to think about health is step one.
Yeah.
Like if you're an engineer and you're actually just thinking about that, that's step one. And step two is knowing resources that you have available to you to help you choose. The resources available to you are some of those government agencies you mentioned, but also you are surrounded by people. You're surrounded by a lot of institutions and schools of public health. Just you don't have to leave Massachusetts, and there's a ton of them. So reach out and collaborate.
This question back.
Yeah, my name is William Kramer. I'm doing sort of mutual aid organizing. I come out of sort of the anti-globalization tradition, and randomly our group is suddenly focused on Nigeria. So I came up to meet with the faculty member from Nigeria here. I have a history with the Sierra Club. I'm not going into too much to my own story, but it's a great event here. The connections are clear. You know, I worked on the Beyond Coal campaign. Right now, we're trying to, at the grassroots level, and it's great to come up here. I'm in Somerville area. We're organizing a kind of a multicultural, anti-globalization style event at the Somerville Library next Tuesday. Hopefully we'll have representatives from the Nigerian American Association here, legal folks. I'm hoping to be part of a delegation, hopefully. It seems like it's a contested election, national organization. So we're putting that out there that we're trying to connect grassroots level. I connected with a woman in Ibadan, you know, it's a university town in Nigeria with like, they train doctors and nurses. I'd love to go be part of that. So, and maybe if you want to answer the question, I mean, public health is central. I mean, I have a daughter who's trans. I've got mental health issues. I mean, all the issues you're connecting with is wonderful. So I'm just inviting people to be a part of that process. We're super grassroots. If anybody wants an internship, I have $200. I could pay somebody to help me with a little bit of a website. But the public health questions, I mean, if we're talking globally, without getting, you know, ideological about it, I mean, obviously in Nigeria, it's complicated. You know, the EPA doesn't have jurisdiction. I mean, do governments have jurisdiction? I mean, the German government, I mean, honestly, I read Deutsche World. I don't, or Al Jazeera, I don't pay attention to the New York Times spin on the story, what's going on in Nigeria. And I don't think we're on the right side in Nigeria, and we weren't on the right side in other countries I've been part of. So without getting too heavy into that, you know, I was part of, you know, wearing this stuff to establish some credibility. What's your opinion as this global situation gets complicated in energy, you know, countries like Brazil, you know, Nigeria, obviously key. I'm starting to learn about it. So how do you see inserting into these various processes, whether it's the UN, the World Health Organization, all that stuff, you know, because the health system here is terrible. I mean, I've thought about moving to Germany because, like, you know, I go in with high blood pressure and they want to give me food, you know, so I got plenty of stories to tell, but just to put it on the table. And that's what we're going to hopefully have a dialogue about, because we're all dealing with, you know, mental health and our basics. So
Yeah,
thank you.
definitely. I mean, it's a hugely difficult situation when we're talking about the world, right? It's much easier when you're just thinking about your community and what you can do locally, but this is such a huge problem. I think, look, if we go onto a global scale, some of you might be aware at the UN Climate Change Conference last year, there was the establishment of a loss and damage fund, which isn't for adaptation, but it's to fund damage and loss for countries that are disproportionately affected by climate change, which is great. It's been was first talked about in 1991, and it's taken this long to get there. One of the huge things about that I think comes down to what you were saying is, where does that money come from? We have not had countries step up and say, yes, I'm devoting billions of dollars to that. Without that money, how can we support renewable technology, for example, in Africa? How can we make this equitable, and how can we expect there to actually be movement towards that in any real way? So for me, that's one of the huge things, is we really need countries like the United States and other big global powers to really step up and take some responsibility, or the health of people is going to suffer. We won't be able to do this.
I mean, just a quick follow-up question. I just learned that Jamie Dimon is an alum of this this school. Not the, and I haven't dug deep on the bank stuff, but banks are obviously critical to this. Like, so I don't know how, from your vantage point, I don't know how hospital systems are financed these days, but obviously international finance is huge, So, and this, Jamie Dimon's one of the leading financial, I don't know, they are actually in Nigeria, one of the few banks in Nigeria, I just found out. So I don't know what kind of dialogue exists, how the partnerships work with Chase, because they're key,
So when we're bringing this all back to health again. So one of the big things, again, it comes back to finance. I mean, Australia has socialized healthcare. We still have I won't say disastrous, there's some good things about it. People can get care generally, but there's a lot of things that aren't working. But we need to once again try and make health equitable, which involves private-public partnerships. It involves government funding for adaptation, is really what you're talking about, because we're trying to make healthcare systems resilient all over the world, wherever you live, because people will need healthcare more as the climate changes, and they'll still have the impacts from the energy transition as well. So there's a whole day we could talk about that.
Yeah.
All right, with that, I thank everyone for coming, and thank you again to our two panelists for a wonderful session on an important topic that we're approaching for the first time at this conference, and hopefully for not the last time. So perhaps next year we will have you back sharing your experiences working back in West Virginia. But thank you both again for coming.
Thank you.